tuning in. Today I have Phil Gibbs, founding principal of the Disruption Lab. Phil's a great guy, incredible treasure. He's spent about 30 years helping large corporations manage innovation and capture innovation for their own benefit. He started in automotive and now has moved to healthcare and lots of other industries. We cover lots of issues. One thing I'll note, we talked through Clayton Christensen, really the creator of the term disruptive innovation up at Harvard. We filmed this about 6 months ago. Unfortunately, Clayton has passed away this January. And so you'll see the show's slightly dated, but a lot of value in there. And really hope you'll turn in and watch. Again, Vic Gatto, this is Phil Gibbs from the Disruption Lab. Thanks. Okay, well, Phil Gibbs, welcome to Harnessing the Storm. Excited to have you on today. Let's start off, just give all the viewers a little bit of background on you. I know you did consulting for a while, then you did your own startup around incubation and co-working space, one of the first ones, and then you moved on to the Disruption Lab. So talk about your background a little bit.
Well, thanks, Vic, and thanks for having me on. My background really over my career has been in some way involved with innovation almost all of my career. If you go back to even my graduate study at Ohio State, I did my thesis work around how organizations can be structured to be both productive and innovative, and that's kind of been the foundation of a lot of the work. Really early in my career, I had the chance to work at the Oak Ridge National Lab, which obviously is one of the great R&D centers in the country, and that was a great experience. And then, as you mentioned, I started a consulting firm called Executive Learning. And this was when what we would call sustaining and efficiency innovation was a major movement in the country. The work of W. Edwards Deming was beginning to be recognized. The Japanese were beating us in almost every sector, from autos to steel and all across multiple sectors. And our initial client was Alcoa, and then we worked at Ford, and we literally walked off the floor at Ford into HCA. And we supported HCA in their rollout of continuous improvement, performance improvement, quality improvement. And that was one of the initial efforts within healthcare. It had been primarily in manufacturing, so this was a kind of a first in the service sector, particularly in healthcare. We were introduced to Don Berwick in Boston, who was doing the National Demonstration Project on Quality Improvement and the Institute for Healthcare Improvement. And those relationships just led to a lot of introductions, and we worked with large systems all over the country in the rollout of quality improvement. And
so what year was that when you first got involved with HCA and started helping them?
That would have been in about mid-'80s, 86, 87, early 90s during that period. Paul Batalden had been recruited to come in. He actually came and pitched Tommy Frist on the concept of applying what was happening in industry within healthcare. And HCA was a real leader across the whole industry in that transformation. But Dr. Batalden and Dr. Berwick working together were thought leaders that really pushed that transformation that impacted all of healthcare.
Yeah. Okay, great. And then talk about eSpaces.
Yeah, well, eSpaces kind of grew out of one of the senior executives at HCA, Doug Smith, who was a real mentor for me. He was leaving HCA. They'd actually spun Quorum out, and he had been the president of the management company and then one of the founders of Quorum. He joined us to do consulting with firms that you had an investment in, kind of do seed investing, which was one of the real early phases of doing that level of investing. And the very first business plan we saw was Passport Health Communication. It was Intermed when we saw it, and it was literally the first business plan we saw, which was turned out to be quite a success story, one of the first health tech success stories in Nashville. We learned a lot of lessons in some other areas, but part of what was happening was the internet was enabling people to work anywhere, anytime, and started looking at that whole concept, exploring it, and the idea of eSpaces, the idea of bringing together kind of the concept of a coffee shop with a executive suites and meshing those two together in a shared workspace was born out of that work. And we launched that in 2010 with the Belmead location, and then have opened in Cool Springs, and we've opened in Franklin and Chattanooga, going to Knoxville and Orlando, and so it's beginning to grow.
So for people around the country, those are all sort of Middle Tennessee locations, and then now you're branching out to other parts of Tennessee and down in Florida. Really, each business led this movement of co-working facilities, shared environments.
There were few around the country that were more like warehouse settings where there was a table and coffee pot and Wi-Fi and come together and work. But to create an enterprise workspace like eSpaces, it was, like you said, one of the first in the country. So it was a real learning experience. It was one of those concepts, one of those ideas that just wouldn't go away. It seemed like it had such potential. And we created it, and people really loved it, but it took quite a period for the adoption to take place and people to start using it, and it to get the traffic that now it has, the number of members, the use of space. And we have evolved the model over time, which is obviously in any kind of startup, you rarely get it right on the very front end. It's all about experimentation, learning, and I've been out of the leadership of it for about 4 or 5 years, still on the board, but it's been rapidly evolving to a model that is really working well.
Yeah, good. And then talk about your current project, Disruption Lab.
So the Disruption Lab kind of grew out of having experienced the quality improvement wave that was a major transformation, and recognizing what the impact that was going to have on the industry. Back in about 14, started looking at innovation seemed to be the very similar to what had happened in quality, except now it was innovation. It was really the early days, efficiency and sustaining innovation. This was more disruptive innovation, more transformative innovation. The speed at which things were moving was just much faster, and so it was a different response. And recognizing that need, started kind of slowly, offered some lunch and learn type sessions, and started offering membership, did some consulting work, and over time have developed it into a center for both connecting innovators, learning about innovation, and focused at the corporate level. Also recognizing, especially here in Nashville and across the country, there are lots of resources to support startups, but the corporations that are facing threats of disruption and innovation from outside, unless you go to the really major consulting firms, there are very few resources. So the Disruption Lab was created to support corporate executives in dealing with innovation.
Yeah, and so let's talk about the Innovators Dilemma for a minute. I mean, I know you've studied it for a long time, I mean, several decades looking into it. I'm not sure everyone understands it as fully. So the way I think about it is, the stronger or the more dominant an operating company is, the more it gets market share and is profitable and grows. And then those very traits make it subject to the Innovators Dilemma, which is how strong they are in operations means that they cannot experiment and do disruptive things because the operations are so strong that they prevent that. And so talk about that dynamic in terms of sort of enabling disruption in a corporation.
Yeah, it is a fascinating concept, and you do a great job of describing it, is as corporations grow, as they get more sophisticated, and what is taught in MBA programs is you're continually improving products and service so you can charge a higher price, make higher margins. And that climb up that value chain makes it very difficult when there is a threat that is approaching from a lower end of the continuum. Kind of the classic example, which is a great story, that Clay Christensen, who created the concept, and kind of as Deming was the thought leader behind quality improvement, Christensen is the primary thought leader behind disruptive innovation.
Yeah, and he's a professor at Harvard Business School.
That's right.
a lot about this. Yeah.
Yes, and his book, The Innovators Dilemma, used the example of the steel mills. And the steel that was made in large integrated steel mills, very expensive, very complicated. And along came mini mills that were much less expensive, much cheaper. They couldn't make as high a quality of steel, so they entered the market at the lowest level, rebar. And because they had a 20% cost advantage, they started taking business for the integrated steel companies. Integrated steel companies looked at it and said, if we exit this and move to more angle iron and structural steel and sheet steel that has a higher margin, our profits can actually go up. So they exited, and so the mini mills were left with that market. The problem was they weren't competing with a higher price competitor, and the price collapsed, and they no longer could make a profit. They looked upstream and said, if we make angle iron and larger bar, we can start making a profit again. And they were able to do that. They started taking market share. The larger steel companies looked at it again and said, that's just a commodity business. If we focus at the higher levels, our margins will increase. And to short circuit the story, they kept going upstream, taking market share. All but one of the integrated steel companies ended up in bankruptcy, and the whole industry was disrupted. And you
right.
see,
And what's really interesting is that at any point, a well-trained business school graduate, rational manager would have made that decision. Like, the right choice was to go with the higher profit margin business and let the young upstarts that don't have that great quality take this junk business. Except
absolutely.
Over time, they lost more and more market share, and then they looked up one day and it was gone. Right?
Exactly. But you see that repeated over and over. When the Japanese automakers came to the U.S., they didn't come with the Lexus. They came with the lower end, I guess, Toyota, the Corolla. And then they worked their way up the value chain and have greatly disrupted the auto industry in this country. And it's happening in healthcare today, where lower parts of the delivery of care is being picked off point by point, and is disrupting healthcare. So it's a pattern that recurs over and over and over.
Right. And what is the prescription? Like, what should a corporation do to try to prevent that?
Well, yeah, that's a great question. It's really hard unless you take a proactive approach. One of the classic examples is Charles Schwab, and they were in the business of trading and doing trading in offices, and they were somewhere around $79 a trade. They had an overhead structure that required that level of pricing. Here came online trading. It was like $7.95 or something like that. They could not be profitable in the overhead structure they had, so they created a new business just for online trading, and it was so successful. My understanding is they rolled the old business into the new businesses. We're still talking about Charles Schwab. They didn't go out of business.
Right.
They disrupted themselves in a sense. I
think the financial services industry is probably, in general, broadly, the best success story of protecting the existing brands, and I think it's largely due to their appetite for risk. They're comfortable taking on risk, and as the technologists rose up, they adopted those things and jumped into the fray, where other companies don't do that.
Yeah, a great example. Another that's happening right now is in the package delivery business, UPS and FedEx. If you think about 3D printing, if you think about overnight shipping, and instead of overnight shipping, I can set a 3D printer in the corner, and every time I need a critical inventory or an item, we just print it off and do not have to overnight ship. So both UPS and FedEx are getting into 3D printing. I think UPS was first. FedEx has a major initiatives going on now under, I think it's called Forward Depots, where they're creating 3D printing centers and will provide that service. So they're being very proactive. They're disrupting themselves. Probably the most interesting example is one of the new disruptors, which is like Lyft, which has disrupted the auto industry and the mobility industry. and we can talk more about that maybe later, but Lyft has also introduced scooters, which are disrupting the car share service.
Right.
And it's just happening so fast now, even the disruptors are having to disrupt themselves. I think that's the really exciting thing. The interesting thing is the pace of changes is occurring so rapidly that even those that are disrupting other industries have to be proactive or be disrupted themselves.
Yeah. Interesting. So let's dive into healthcare. I think, I have a focus on healthcare only. It's 20% of the economy,
right?
And it's really impactful to all of our lives. So kind of big enough to focus on. And we're kind of following 4 pretty large trends that I want to just run through and then get your comments on. So Just quickly, the 4 trends are the rise of the consumer kind of rising up and taking control of their data, of information, decision-making authority, and financial responsibility. And what does that mean to the need of brand and information to consumers? I see healthcare moving away from the inpatient big hospital systems and into the neighborhood or the home. Technology tools, automation, telecommunications, data science, artificial intelligence, sort of empowering healthcare providers and healthcare broadly to be more effective, more efficient. And then lastly, market entry by big consumer tech or technology players, retail players that haven't been in healthcare before that now are jumping in and seeing a pretty large market that they feel like they can steal market share and steal earnings from. What are you seeing out there? You spend a lot of time in healthcare. What are you seeing of those trends or others that are making a difference now?
Yeah, I think those are definitely trends that are beginning to create disruption within healthcare. And sometimes people talk about when is it going to happen. We're in the middle of disruption now. It is happening. And it's starting to happen pretty rapidly. And it's the exponential curve can be really tricky because you look at it, it seems flat a long time, but when it turns up, game is over.
Right,
so you look at things like telemedicine. It's been around a long time, but because of regulation and reimbursement and technology, it has been slow to develop. But that is coming very rapidly, and there have been changes in reimbursement and some of those factors that have been restraining it.
That's going to have a major impact. And then 5G, the wireless. Because the latency is going to go down really quickly where you'll be able to do real-time interactions without any latency problems.
I think what you described as care moving out of hospitals and out of expensive centers of care, to me that's right at the core of what's going to have a major impact, especially in the city you and I live in, here in Nashville, being a hospital-based, facility-based town. And that is happening very rapidly. And it fits a pattern. It's not just healthcare. It's part of a decentralization of everything. So if you think of retail, that's what's happening in retail. Retail, you can buy anything, anywhere, anytime, convenience. And the large stores are just fighting for survival, the traditional stores. You look at it in food. Restaurants now are almost factories that produce food that are then delivered to the home and other locations. They're not necessarily people going and eating at restaurants. That still happens, but the trends are very different than we've seen in the past.
And it's really challenging for a big hospital system to react to, right? Because they have significant capital assets, buildings, equipment spread around the country that they've invested decades in. Right. And all of a sudden they need to rethink how they use those assets, or it may not even be that those assets are that valuable anymore. And in the meantime, a new startup doesn't have that sort of inherent kind of baggage to carry around. They can be much more nimble and jump into opportunities.
Yeah, that's a real challenge for the legacy companies, for the incumbents, because they have that fixed cost investment. But that is kind of an anchor that is holding them back. But it's just like the auto industry. If you think about the massive investment they have in the car manufacturing plants, but the number of cars that are going to be required in the future is certainly leveling off, flattening, if not declining. And they're having to face the same type of challenges moving from a car company to a mobility company. In healthcare, you can think in some sense of the car, the hospital room or the surgery suite being like the car, and there's going to have to be a transition away from that. It is a real challenge for hospitals.
Yeah, it's a real challenge. It's a version of the sunk cost fallacy. Like,
that's right.
You have all these assets out there that is very emotionally jarring, and yet they have to not make decisions based on that.
That's right. That is exactly right. The good news is the opportunities are massive, just like in the automobile industry with autonomous vehicles coming, all of the things, electrification, connectivity, all of those things. When car companies reimagine themselves as mobility companies, it opens vast opportunities for growth.
Yeah.
When hospitals and healthcare companies stop just thinking of themselves as sick care companies and start reimagining themselves as health companies, it opens up vast growth opportunities. They still have the sunk cost and the capital cost issues to deal with, but the growth opportunities are there, and they're just some great opportunities for massive growth for the healthcare companies, but it's going to take a repositioning their thinking, reimagining the mission.
Yeah, I think I totally agree. The challenge is in your thought process and rethinking the approach to grabbing the opportunity.
Right.
It's out there. They just need to reimagine or rethink their strategy or their approach to it.
Yes.
So with that, let's take our first break, and then we'll be right back. I want to talk about market timing and how this will play out in the future. Phil, I want to talk about the timing of things, because really timing is everything as you think about disruption in healthcare. Healthcare is highly regulated. There's people's life at stake, and we need to be careful and cautious how we disrupt things. And yet, as a society, we must disrupt it. We must get it more efficient, more effective, get better outcomes. How do you think about sort of the industry shifting and timing of things?
Yeah, that's the issue of what you're describing in terms of the risk involved and the timing and how fast you go. That's one of those questions that in some respects you almost want to cry and you want to laugh. It's a really difficult challenge. And when people say we cannot do this innovation because we're not sure what the risk is, assumes that our present system is a perfect system. And we all know the number, what is medical errors are the third leading cause of death in the country, 250,000 or more per year, and the number of injuries from unnecessary medical procedures and medical errors. So the present system certainly has its challenges. That doesn't mean we can just go do anything. We can be Silicon Valley and break things and do whatever. It still has to be paced. You're exactly right. But we cannot start with the assumption that everything today is fine and we're replacing with something that may not be as good.
Yeah,
so
I take the opposite approach. I mean, my view is that the only thing I know is the status quo is not sustainable, right?
Right.
Everything else I'm not sure about, but I know that's true. And so we need to experiment. We need to change things. Yes, we should test, and the FDA is in place for a reason. We need to follow the rules, patient safety, privacy of data. These are all critical things in health. And yet we have to make a change and get better.
That's right. Yeah, absolutely. And those things have to continue to be there. And we have to put safeguards as new things come along. I don't mean to imply that at all. That has to be there. But we have to recognize that, as you said, the status quo is not acceptable. We have to make changes. I think there are many, many, many opportunities to do things that at the edges, as you described, where we can move very rapidly and can tap into non-consumption and can provide services, improve health, and provide new revenue streams for the participants who are in those. We have a great example here in Nashville with Smile Direct Club that is disrupting orthodontists. And that they're just, I'm sure you saw the recent announcement.
Describe that for the listeners, how they work.
Yeah, so when you needed your teeth straightened, you weren't happy with your teeth, you would make an appointment with dentist, orthodontist. It would cost $4,000 or so, and at least very expensive, maybe more than that.
Right.
It's very expensive. So the characteristics of areas that are vulnerable to disruption are they're really complicated, they're difficult to access, and they're expensive. When you see something like that, which is classic description within healthcare, you see an opportunity to disrupt. So what Smile Direct Club does is they do scans. They send you get a scan, and then you get in the mail these virtually invisible straighteners that fit over your teeth, and over time straighten the teeth. It costs about half as much. You don't have as many appointments with the orthodontist. You still have some contact. I think there are telemedicine or calls involved. They're still reviewed by an orthodontist, but there's less direct contact with those providers.
Yeah, and what's really interesting is they have, I know those guys well, they have really opened up an entire new market of people that didn't have the money or were kind of embarrassed about going to an orthodontist, but they were in their mid-adult life and they wanted to fix their teeth. And so they've grown incredibly fast, and they really haven't stolen away from the classic 7th, 8th grade braces. They've taken a whole new market that wouldn't have been opened up before.
Yeah, that's an excellent point. And that's the exciting thing when you really are doing disruptive innovation. You're tapping into non-consumption. Mm-hmm. And so that provides the real growth opportunity. One of our friends in the legal space, Larry Bridgesmith, whom you probably know, leading innovation in practice of law, talks about approximately 85% of legal matters people go it on their own. I'm not sure what the number is, the percentage is in healthcare, but it's a lot of healthcare, just like we were talking about, that could be accessed if it were more accessible, if it was more affordable, if it was more convenient. And I believe
I think that's right. The edges or the places where, I don't think we're going to disrupt triple bypass heart surgery, in the next couple months. But early diagnostics are easy. Right? Telemedicine, urgent care, right. Orthopedics, all the periphery of dental, vision, hearing, fitness, all those things. As you know, I have a VC firm. We're investing in all of those areas because you can deliver a product that is 10 times more effective at half the price. And
exactly.
Of course I would use it. I don't like the existing system, and I'll jump on that.
Yeah, and there are hundreds of opportunities like Smile Direct Club to tap into those. It's just starting to see the patterns that are there. It's like we were talking about with the decentralization of everything. When you start seeing those patterns and products and services that are really complex, difficult to access, and expensive, and you find a way to make it, just like you described, more affordable and accessible, you've got a great growth opportunity. You're going to tap into people who aren't currently accessing it, and you're going to grow your company, grow the market. Yeah,
one of the things I like about healthcare is you can really impact people's life. For like straightening someone's teeth brings them out much more. They have more confidence. They're happier, and you can also make good money at it. So you get this double bottom line aspect where it's impactful on people's life, and it maybe is letting them live longer and see their grandchildren graduate high school or things, but also just make them happier and more willing to go out and socialize. And it's super profitable too. So it's a good combination.
Exactly. Yeah, that's a great description.
So you mentioned something about Silicon Valley. I feel like we had one last week. I'm not going to name them because I've been in trouble over the last couple of months calling out bad actors. But every month or so there are Silicon Valley bad actors that are kind of, cutting corners or not filing information correctly, not coding correctly, not billing correctly. And you mentioned the sort of mantra, it's a Zuckerberg quote, actually, let's move fast and break things and see what happens. And that's kind of how Silicon Valley views everything. And I agree with you, I think, where you're going, which is that that's fine for Facebook launching a new feature, whatever it is, some new way for me to see my high school friends, what they're doing at the beach. If that doesn't work and breaks, no one dies. No one's patient records gets out on the internet. I think in healthcare, there's a bigger responsibility to do things the right way and be cautious about things. Talk about that dynamic between being respectful of human life and privacy, and yet innovating simultaneously.
Yeah, and I don't think they're in conflict. When people are cutting corners, that's just cutting corners. That's not inherent in the innovation process.
Right.
Kind of the core of the innovation process as we view it is really understanding the jobs that people are searching for products and services to do, that they can, as Christensen describes, hire into their lives. Once you start with that basis and understand what is the product or service that's going to address a job that people have, and then you start with a hypothesis that says, if we provide this type of product or this service, we're going to get this kind of result. And then you start experimenting and validating the concept. Only when you have it validated are you ready to scale it. So anyone who's not following the basic process is going to, at some point, obviously there are going to be problems. They're going to run into legal or regulatory or compliance issues. But the whole innovation disruption process is really not about breaking things. It's about systematically, rapidly validating a hypothesis. And once you've got it validated, then you scale it. It's really pretty simple, the process.
So I'm glad
hard
you
to do.
position it that way. I completely agree. I think Silicon Valley has taken a core concept of innovation and kind of bastardized it or made it into their own because it sells ads and gets people to move out there. But that's not really what it's about.
No.
It's a culture of cutting corners and doing things quickly that we don't need. We do need to find solutions and iterate and change and find what the customer wants and solve things.
Right.
But we can do that in a respectful way for human life and data and get it out there. And the FDA is in place for a reason. We should respect that.
Absolutely. And when we talk about moving fast and doing it inexpensively, we're not talking about cutting corners. The lean startup taught us many lessons about how you validate things without having to build the final product. Right. to validate it. And so we've learned a lot over the last several years about how to move fast, how to not spend 6 months writing a business plan, but put your concept on a one-page canvas that you can then look at each section of it and move it from red to green. You validated that part of it. And once you've validated it, then you can move forward. So it's about moving very quickly, very inexpensively to validate a concept that then you take and scale. Again, it's a pretty simple process.
And also, I think in healthcare, it's valuable to understand the networks that you're disrupting. So the value networks, the way that value is delivered to a patient or to an employer or to a payer or to a doctor is very intertwined. Right. And so you can innovate and take out a section, make it better and put it back in. But you have to really understand the overall network. And so places like Nashville and Minneapolis and Dallas and some spots in Florida and Arizona and Denver, there's several places around the country that actually know healthcare a lot better than Silicon Valley. And so the entrepreneurs in those areas are great. And we have probably 80 investments or so. And so if you do that many, you end up with some in the Valley. Right. But there's health entrepreneurs across the country that are doing great work because you really have to understand healthcare to be successful, I think.
Yeah, exactly. And it is a complicated system, primarily, or at least in part, because of our payment system causes it to be an irrational system in many respects. But it is what it is. And like you said, when you start on the edges and you start simplifying that, then you can work your way in. And that's happening. And there are lots of examples where taking a value-based approach, combining health coaches with providers and a whole team providing the service, but you're still within the system, operating within the system, operating within the payment system. And there are, of course, experiments with different types of payment systems. So I think it is a systematic approach to experimenting with different approaches that over time will simplify. But yeah, the system is what it is, and we have to operate within that while at the same time we're working to totally remake it.
So Phil, talk about the process of innovation kind of building up in pieces and parts, does there exist a time when there's enough of foundation, enough tools out there, enough foundation or background that you can see a tipping point, and then all of a sudden it goes much more quickly? Have you seen that in other industries, or are there examples, things to look for maybe in healthcare?
Yeah, I'm not sure that there's an exact tipping point that we're going to look at it. Usually we do it after the fact. We look back and say,
yeah,
at that point.
That was it. In the summer of 2019, we just didn't know it at the time.
That's right. When you're in the middle of it, you do not recognize it. I think we're well into it. And I think the data analytics, all that's happening around digital transformation, which is driving, I really do not think that the technology is the primary driver, but it's enabling it. It's wrapping new business models, new ways of delivering care around those new technologies that generally provide the major breakthroughs. And I think that is beginning to happen. You're seeing examples of it beginning to pop up. It's because it's, like you said, it's almost 20% of the economy. It's not going to change overnight. And even when it's disrupted, that doesn't mean, when Airbnb disrupted the hotel industry, that didn't mean that Marriott and Hyatt and all the hotels go away. They're still doing well. It does mean they're not going to have as much growth opportunity. And in healthcare, it doesn't mean that all the healthcare systems are going to go away. Some of them could be in trouble if they do not adopt some of the new innovative approaches to delivering care. But it is a system that I think is beginning, whether it's at the tipping point, I don't know. But I think there are a lot of signs that a lot of things are changing quickly. Again, the exponential curve is what's tricky. It's things like all the monitoring capability, care at home, telemedicine, all of those things. At some point, we're going to start seeing that being the standard. When someone comes in for admission, they're going to be given the option of being admitted to the hospital or admitted to the home.
Yeah.
We're not quite there, but when that happens, then that's going to start happening very quickly, because that's what people want. People want their...
Right, so I think I agree that it's not going to change where no hospitals exist, and yet the series is called Harnessing the Storm. I think there will be a storm around healthcare that is really disruptive and really destructive to the industry. Where I mean, we have 5,000 hospitals in the country. I think we need 2,000, and we have all these physician groups and practicing physicians, and I think we need half of them. And we don't need as many insurance companies. And we're going to have much more streamlining of services, and it'll be much better for the end patient and more effective and less expensive. But I think there'll be new market entries and a lot of disruption and challenge for the establishment. What are your thoughts about that concept of a storm coming to the industry?
I totally agree with that. I don't know exactly when it's going to arrive, but I totally agree with that. And as, again, technology enables this, it's not the total solution, but it enables. And as we move care to the appropriate level of staffing from physicians and others who do not need to be doing lots of what they're doing, which leads to what you described as needing half, perhaps, of the physicians that we have today, as we move care out of the hospitals into other care settings, we're going to need, as you said, maybe half the hospitals we have today.
Yeah,
and that is going to create a storm.
Half the physicians and 4 times the home care workers.
Absolutely.
Yeah.
Yes, absolutely. You know, one thing that struck me that made me realize this is really coming. If you think about being in a hospital bed and pushing the nurse call button, and you think about standing on the corner of the street, downtown Nashville, and hitting your Uber button, and thinking about which is going to arrive first. I'm not sure, but in some cases, Uber is going to...
No question Uber's in.
And if you think about having mobile caregivers in urban areas who can... The ability to treat... if people need to be in the ICU, they need to be in the ICU. But for a lot of the care, it's going to, that kind of care and that kind of support is available. And again, technology is enabling it, but it's a totally different model of care delivery. Yeah,
so talk to me about what you mean by the exponential curve. I mean, I think I know, but like as you're watching it, it's slow, slow, slow. As an executive, you might say that's not even really that important. And then all of a sudden, it knocks you over quickly. Is that sort of, or maybe you explain it how you?
Yeah, it's basically doubling. It's doubling every. Say in technology, there's been the concept of Moore's law and how that drives the breakthrough and improvement and the doubling the capability with processing basically every year and a half. And so as we are dealing with technical challenges, initially it is very, very slow. And if you just go through a simple process of multiplying 1 times 1 and go through the multiplication process of doubling, initially it's pretty slow. And then you start multiplying 64 times 64 and you all of a sudden you're into the millions very, very quickly. And it took a long time to get there. I think the mapping of the human genome was probably the first example. They were halfway into it. They had spent half of their budget. It was like a $2 billion project. And the question was asked, why don't you abandon this? And you're only 1% there. And he said, 1%? We're halfway there. And they ended up completing it on time, under budget. And that's just...
And then today, I can do it for $20.
Yeah, absolutely. And that's what's happening in so many areas and so many things, the things that have cost. So if you go back to the mainframe computer, which was extremely complex, it took a lot of knowledge to operate it. There was only a market for a few of those, major universities, major corporations. And then you move out from that, and you move out from that, and all of a sudden I can buy the capacity of that mainframe computer and have it in my pocket in the form of a smartphone. And that is the type of growth we're talking about. And that's the opportunity that exists in almost every area where you're applying technology.
Yeah, so if you bring it back to healthcare, let's say we can treat 2 diseases today in the home, right? But a year from now, we can treat 4, and then a year later, 8. In 10 years, we can treat all the diseases in the world in the home.
Yeah, that's a great example, a great way to think about it.
Right, so if you are running a big hospital, it looks like, 2 diseases is not impactful, except in 10 years, you're out of business.
That's right. That is exactly right. And the cost of, like you said, talked about mapping the genome, what it is today. You think of every procedure, a scan today that may cost $9,000 may cost $9 in just a few years because of and that has obviously major implications for revenue and income, which means you have to be looking at different growth opportunities.
Right. The lab itself. So what have you created there? How do you work with it to educate executives?
Yeah, well, we basically say that the purpose of the Disruption Lab is to equip executives to invent the future. And we do that through 3 means. We do it by helping executives and innovators connect with others who are interested in innovation. We have local networking opportunities, and then we have a digital portal where they can mentor and be mentored and connect with other innovators literally around the globe. Second area is learning about innovation. We have monthly learning events. We do a daily disruption, 6 a.m. every morning. A news feed goes out with curated and original content around innovation. And then we do a global, annual global executive innovation program. So this year we're going to Singapore in the end of July, 1st of August. And we'll spend a week there, do a deep dive, visit about 16 or so companies, learn what they're doing, learn their approach to innovation, just learn the innovation ecosystem, both at the corporate level and the startup level. Last year, we went to Estonia and went to Helsinki, Finland, and studied innovation there. Just some fantastic learning opportunities that we had to understand what they're doing across industries. A lot of healthcare, smart city, multiple areas that we were learning about. In Estonia, they are, of course, one of the leading digital nations, most advanced digital society in the world. They like to describe it as
a full digital society.
Yes. And it's amazing to see what they're doing there. The year before, we went to Barcelona and New York, and just, again, a great experience. And
so tell me about the membership. Who is the ideal person to become a member? What does that person look like?
It's an executive in a corporation who is interested in innovation, wants to learn about innovation, is leading innovation, and they're part of the organization. And it could be a person who's solely devoted to innovation, but in most cases, they have other job responsibilities, but recognize what's coming, recognizing disruption that's coming. They want to be on the cutting edge and be sure they're leading their organizations. We also have some early stage and startup companies, and we think that mix is really important, but our primary focus is at the corporate level. It's a subscription basis.
All different types of industry leaders, and they sort of learn from each other. Is that right?
That is correct. Yes. We think that's really important. You can think that you're real on the cutting edge, really advanced, and then you look at what's happening in some other industries and you realize we're not quite so far along. We've still got a lot of work to do. So we think in the innovation space, in healthcare, you have to have some depth of knowledge in healthcare to approach innovation in healthcare, but still having an approach that looks at what's happening in other industries. We think that's important. Being based here in Nashville, most of our work will be around healthcare, but we still do work in other industries as well.
Yeah.
In fact, one of the things we have some of the folks from Helsinki coming over next week from their smart building industry, about 8 or 9 companies, and they will be presenting on what they're doing in the smart building space and interacting and communicating with and building relationships with companies in the construction industry here in Nashville, and forming that bridge, forming that relationship. And you can learn in healthcare some important lessons about how they go about innovation in the smart building area. So there are lessons to be learned across sectors.
I think there's no question. In healthcare, folks can learn from almost any industry, building, architecture, financial services, technology. You can almost pick any industry and
That's right. That's right. Yes. One of the things we're doing specifically in healthcare is we've developed what we call Lab 2025. And what we're approaching that is 3 phases. And the first phase is a healthcare innovation academy, which has basically 3 tracks: on-site visits with innovation centers around the country, a training curriculum with both live and online training, and then case studies and projects. And it's a 6-month cohort, really focused in depth of learning about innovation and how it's applied in healthcare, what's coming, a lot of the things that we have talked about and been discussing. And then looking at moving into projects where they're creating new products and services that have the opportunity to impact healthcare, to build new businesses, new revenue streams, to replace those that are being disrupted, with the criteria of developing very significant businesses out of that. It's actually doing innovation.
And the members, do they join for a year, or what's the structure? How do they get involved?
Yes, it's a simple process. Go online and sign up, and it's a year membership. You can pay it on an annual basis. You can pay it on a month-to-month basis as well. Right. And we kind of disrupted ourselves. In a sense, if you think about traditional consulting, it's hard to access, it's expensive, it's complicated. You sign a large contract. So we're making the services available simply on a subscription basis. You go online, sign up, and you pay a small amount each month, and you have access to resources to learn about and apply innovation. So in a sense, we're trying to disrupt the traditional consulting industry, how people receive advice and consulting in a particular area, in this case, innovation.
Yeah, and what I think is really interesting is that they certainly learn from you and other sort of faculty or members of the Disruption Lab, but they also learn from each other and sort of share information back and forth.
Yes, and Lab 2025 is built on that. It's collaborative learning, and it has to be that way. It's moving so fast. I think the data, if you talk about an example of exponential growth, the rate at which medical knowledge, now I think it's projected in 2020, one number that is used is every 73 days. No one person can even approach keeping up with what's happening in the innovation space, certainly in the medical space. So it has to be collaborative learning, bringing multiple people together to learn from each other. We'll structure it, we'll facilitate it, but it's a collaborative learning process.
And then you do some really cool trips too, that you mentioned several of them in the past. Is that only open for members, or is it possible to sort of get to know it and go on a little trip just to learn about it a little bit?
Well, it's discounted for members, so most people that would go would become a member. Membership is not that expensive. Yeah. So yes, but we would love to have anyone who's interested in seeing innovation in a very different environment, different culture. As I mentioned, going to Singapore, they I think it's 7.4% is their spending on healthcare each on an annual basis. Yeah. They're at a different place in healthcare. They've just opened this month in May a 9-story healthcare innovation laboratory center, totally focused on healthcare innovation. So I think it's going to be an opportunity to learn some really interesting.
I've studied their model. They have an incredible system over there. It's one of the best national systems, really well run. It's a much smaller country, of course, than we have, but super well run and efficient. They do have great outcomes there too.
Right. And I think we have an opportunity to learn some significant things about how they are approaching it. And so we'll be on the ground learning from them. And we'd love to have anyone who would be interested in participating in that. You can go online and sign up, and obviously we'd be glad.
Well, we've had the link. I mean, the link is right below, so they can click on that and just jump right to it.
Exactly.
And learn about it or sign up easily. So, okay, talk to me about other trends in innovation or in healthcare disruption that you see out there.
Well, to me, the most exciting thing about it is, I think in healthcare, it's been such a tough industry for so long that it's been so much focus on cost cutting and efficiency. It hasn't been that much fun to be in at least certain parts of healthcare for some time. And I think we're getting to it, if we just how we think about the opportunities, it can really be huge growth opportunities within healthcare. The one way I think about it is to think about the healthcare system as a platform for creating new products and services. We tend to think about our healthcare organizations as delivering healthcare products and services, but the companies that we tend to envy, the Amazons of the world, see themselves as a platform for creating new businesses. They're doing their current business, but they're constantly searching for new opportunities. And they do constant experimentation. And when they find something that works, they double down on it and create new businesses. They started out selling books, but now services. They're into all sorts of businesses because they experimented and found opportunities. And I'm not necessarily suggesting healthcare companies go off in all sorts of businesses, but there are huge opportunities, especially when you expand the vision to health and well-being, what we were talking about in some earlier examples. I think the trend is we can move from just cost cutting, which we still have to do, but we can also create new opportunities, create new revenue streams for our organizations, and that can be really exciting and really fun.
Yeah, so if you untether the corporate strategy from let's maintain the status quo and try to hunker down and protect what we have, and more open it up to what can we do with the assets we have? How can we move into food and diet and exercise and fitness and wellness? And then when you get sick, we will also get you better. It opens up a much broader set of things. The challenge is not that there's no opportunity. There's tons of opportunity. The challenge is getting the executives to sort of stop hiding under the bed and hoping no one comes, and opening up and trying to be more opportunistic, and let's view the world as abundance and glass half full, and try to be, productively out there creating new products as opposed to defensive and protective.
I think that's exactly right. And the platform that exists is an amazing platform. You've got the facilities, you've got technology, the human resources. In local communities, the healthcare systems are a respected brand in almost every case. And so there already exists this amazing platform to apply to opportunities. Just experiment, find something that works, and then double down on it. And it's a great formula. And that's what the technology, that's what Apple is, a computer company, but they're in healthcare. Right. Healthcare companies, and you look at almost all of those types of companies. What all Google is into, a search company that's into autonomous vehicles through Alphabet. And you just go across the all of those technology types of companies. So in the healthcare arena, again, there are opportunities, and maybe the leadership will not expand to the point that the technology companies have, but even within health and well-being, the opportunities are really abundant.
Yeah, I agree, and I'm concerned that a lot of management teams are not really looking out that way. We're investing in a whole bunch of startups that are viewing this as an abundant opportunity and grabbing things. Right. And I fear that the corporate guys are slower to change.
Yeah, and that goes back to the Innovators Dilemma that we talked about earlier, and the cost pressures and the very thin margins operating from now. What I fear is a lot of innovation in a lot of healthcare systems is one of two things. It's the cost cutting, the efficiency innovation, which they have to do and keep doing, but you can't cut your way to growth and long-term survival. The other opportunity is scanning the environment for the startup that appears to be a shiny object that's going to finally fix our problem and solve everything, and that rarely happens. So it's not that they have to devote tremendous amount of resources, but if they devote just a small amount of resources to creating new products and services, the return on that can be, in fact, the data that where you look at core and adjacent and not disruptive, but transformative innovation, which parallels disruptive, that the 10%, the top companies put 10% there, but 70% of the return comes from that. So just putting a small, it doesn't even have to be 10%. Some investment on those types of transformative opportunities can lead to real growth, but it's a challenge.
Just like I'm saying, I like to invest in or work with startup companies or teams that really understand healthcare, because it's complicated. Right. The healthcare incumbents really know it well, and so they can invest 10% or a small amount of capital and time, but really know exactly where to put it because they're living it every day.
That's exactly right. Yeah, and they've got the systems, they've got the people, they've got the expertise. Now they need to take it to the edge of the organization or outside the organization to otherwise antibodies will come out and attack it. But the opportunity is there, and so the opportunity for growth is just I think pretty amazing. But that doesn't mean it's easy. It's still it's a challenge. It's difficult. They're in a tough position. But I think there is a real opportunity to create growth, and that creates a different mindset. It involves people in something that can be really challenging and exciting. And I think that's just leadership has to do that in the environment we're in today.
Yeah, I mean, I follow Amazon a lot just because they're pretty interesting out there, and they're moving into healthcare. But the story of the Kindle is, I think, really illustrative in this world, where Bezos said, electronic books are going to destroy our business. And so he set a group of guys with a bunch of, and maybe women too, guys and girls, in Silicon Valley, away from Seattle, give them a bunch of money. And the mandate was, please destroy our book selling business, which was the core of Amazon, crush us. And they invented the Kindle, which was beautiful and smart. But a lot of health companies, I fear, are not going to be willing to sort of put them on the edge or out in the field like that with a mandate of destroy our hospital. It's going to be, on the third floor, right next to the CFO's office, where they can be watched, and they can't do that much cool stuff there.
Yeah, that's those lessons are I think being applied in other industries. FedEx, we talked about doing 3D printing, was
Yeah.
experimenting with 3D printing in a little building in Cordova, Tennessee, kind of at the edge of the organization, and they were able to learn a lot, make a lot of advances because they weren't in the core of the business.
Right.
And that's true across, I think, across industries, and healthcare has got to learn that lesson too. It will not work if it's right in the middle core of the business. It's got to go to the edge of the organization or outside of it.
Okay, well, Phil, great. Thanks for walking me through this. Just as an ending, talk to me about, lots of change, lots of excitement, lots of things to be nervous about if you're an executive, particularly. What do you see out there in these trends, particularly in healthcare? I know you cover lots of industries, but in healthcare, what's most scary and what's most exciting over the next 5 years?
Yeah, I think what's most scary is for the organizations that are doing pretty well now and just think that we can hang on and we're doing well. We're different than other organizations. Healthcare is different than other organizations. We're complicated. Other people can't come in and do what we're doing. And it's going to be disrupted, and they're going to wake up and that curve is turned up and it's going to be too late. And that is just, unfortunately, that's scary. It's sad. They're going to be people. The storm you refer to is going to come. And the whole industry won't be wiped out, but they're going to be organizations that aren't ready for that coming.
Yeah, I mean, I worry about cities like Nashville, where, yes, I don't know, 80% of our local economy is related to big hospital facilities. And are they going to be reacting in time? Or are we going to be like Rochester, New York with Kodak, or Detroit, or, there's plenty of examples where the industry didn't evolve and other people came in. Certainly, I take pictures all the time on my digital phone,
right?
But it's not using Kodak paper.
That's right. That is exactly right. And we're sitting with the potential of that happening again. And we know it, but it's still the pressure to maintain the status quo is so strong. Again, it's back to the Innovators Dilemma that we started with. It doesn't make sense to abandon what is working now, and the hope is that it just will not come, but it's coming and coming quickly. So
yeah,
that's
the storm
scary.
Is out there. I'm working on my weather forecasting, when it will land, but it's coming our way. So yeah. Okay, well, so let's end with what you're most excited about.
Well, I'm excited about the opportunities, what I was talking about a few moments ago. Once you start looking around, once you start seeing the patterns that really work, once you understand the innovation process, and while it is hard, in some respects, it's a pretty simple process. You can follow a set of steps, and you validate or don't validate, or you pivot and make a change. And once you do that, you've got a great opportunity for success. And I think the opportunities are absolutely amazing. And that's exciting to me. I've had a chance, as we were talking about earlier, to be involved in some successful startups and successful innovations. And it's you go through some difficult times. You have to pivot. You have to change to get there. But the opportunities that are out there, I hear people talk about, I just can't come up with any new ideas. And as I look around, just like we were talking about Smile Direct Club, I think there are 50 Smile Direct Clubs just laying around that just to go out and be picked up. And I say that, I don't mean to say it's easy and you can just go do it. But the opportunities are there, I think, at a greater scale than we realize to do significant
I think that's right. I mean, one of the most fun things about being a VC is it's really hard to impact the world and bring it to your will and bring your solution out there. It is lots of trial and learning and error and figuring out and trying something new. But then being there at the table when it all clicks and you start to get the nodding of heads and the customers that really have this problem start saying about your prototype, well, can I just take this home with me because I don't want to leave it?
Yeah.
It's super fun then to see that happen, and it affects people's life, and it's a lot of money, and it's really fun. Now,
Yes.
there's a ton of opportunity. It's also really hard to get it right. And so you
That's
need
right.
to sort of balance those things, but it is really fun when it happens.
Yes, I think the opportunity, and I don't mean to oversimplify. I just think there's more opportunity than, and particularly in healthcare, there's just so many opportunities to create products and services that are simpler and more affordable for people, that improve their lives and make a real difference. And people want to be involved in things like that. So I think those opportunities are really exciting. You're going to fail. You have to realize that at times you're going to fail. It's just not going to work. As an entrepreneur, you're not always going to be successful.
I'm going to write a post about this. I haven't got my act together to do it, but I think failure is another name for learning. Right?
Absolutely.
So, yes, you're going to fail, and that is how you get to be successful.
That's right. And once you do it multiple times and you fail, you realize I'm still here. And yes, we fell flat on our face, but we're still here. We're still moving forward. We're still learning. And you break through that culture that in most organizations is just not acceptable. Once that is established, once you're doing that, you start seeing opportunities. It can be really exciting. Not easy, but it is it's an exciting way to spend time, to make a real contribution, which I think most people want to do.
Right. Great. Well, Phil Gibbs from the Disruption Lab, thanks for your time. Really fun to talk through this. I learned a lot. I think our audience learned a lot. And hopefully we'll get some new members to sort of travel with you and start disrupting things together.
Thanks, Vic.
Thanks for your time.
Enjoyed it. Thanks so much.
Okay. Bye.